In the Alchemi-Culture philosophy, there are 7 polar aspects of humanity that we need to look at if we hope to transform ourselves and the world around us. These are cosmology and philosophy, law and justice, economics and currency, citizenship and social dynamics, agriculture and ecology, science and technology, and healing and medicine. In this podcast, we're going to talk about these topics. We're going to expose ideas that can help inspire an alchemical transformation of our culture, one listener at a time. Hi there, everybody, and thank you so much for joining us for this episode of the Alchemi-Culture Podcast. I am your host, Phoenix Aurelius, and today we're talking with one of our dear friends and colleagues, Dr. Dirk Jacobsen, DDS, who is a specialist on many different issues pertaining to dentistry, everything from airway and cranial structure to diet and nutrition and the importance that this has in dental wellness, to cavitations and so many other things, because people don't realize that dental health really is a major foundation of all other aspects of the body. It controls a lot of different types of things, and many different nerves are connected to all sorts of different places in the body. We tend to just look at it as, do we have cavities or do we not? Do we need fillings or do we not? And there's so much more to the dental picture than this. So I figured, who better than our very good friend, Dr. Dirk, to weigh in on this topic. Dirk, thank you so much for joining us today. How are you doing, man?
Yeah, I'm very well, Phoenix, and thank you for the lovely introduction. Thank you very much, appreciated. And yes, you're right. I mean, in dentistry, see, my career goes back 35 years now. And when I studied back in Germany, it was, as you mentioned, we were focusing on teeth, on bad teeth, and what can we do to restore teeth. And it was very, very limited, our perspective on the whole subject. But the longer I was looking into subjects like that and widened my field, also in holistic aspects of dentistry, I could see that there's way more to it, and that the mouth is actually the entry to the whole body. And it's not just that, but whatever happens in the mouth is crucial for our health in total as well. And so that got me more and more interested in also, facial development and breathing issues, which are prevalent today more than they were in the past. And this is a subject we hear everywhere, that people have problems with breathing, and they need all sorts of support to get their breathing right. Allergies and asthma is one big thing. And these things, they are all related to the way our nasal cavities have grown and the way we are able to breathe. And mouth breathing is a big problem these days. And it's they say that mouth breathing is contributing to lots of these problems and ailments that we are facing today.
So, yeah, which is amazing. Let's actually dive into this here for a minute, because recently I had a conversation with Dr. Meghna Dasani. I'm not sure if you know who she is, but she's been featured in all sorts of different types of magazines and on television stuff. She's an airway specialist, so she's a dentist, but she's just focusing on airway health, which is really quite a fascinating topic. But one of the questions that I had for her was essentially talking about UARS, or upper airway respiratory syndrome. And this is oftentimes referred to, you hear it talked about in certain articles and amongst certain groups, as being pretty skinny women's disease, because all of these beautiful women have these kind of smaller facial structures, smaller nose, small palate, and nobody would ever think historically that they have a breathing disorder, because they're not fat, they're not tall, big men, snoring, etc., things like this. But in their sleep, they're getting cut off from all sorts of oxygen. And then now they're showing that there's links between this and polycystic ovarian syndrome and different types of autoimmune conditions, just immune stress, lacking neurological function. I mean, there's so many things that have been tied into poor airways, specifically during sleep. So I'd love to hear a little bit more about kind of your take on the airway, and maybe, one of the things maybe where we could start our conversation is I heard that when Weston Price went and studied all of the different indigenous cultures, he noticed that there was a certain width between some of the back two molars, and not the furthest back ones, but I think that was like 38 millimeters, if I remember right. And they all had 38 or wider, and they had these huge big smiles, and you could see all of their back molars when they would smile. And then now today, I mean, very few people have that. How frequent is it, do you think, that people have that small palate, that narrow palate?
Well, look, you touched on many subjects just there in your intro, Phoenix. And so, well, let's start with Weston Price. And you mentioned the distance between the upper molars. And what he was referring to is that, see, he went to, during a time in the very early stages of the last century, when things were shifting in many cultures, like suddenly old cultures were exposed to our Western culture, and suddenly basically in no time, their food changed as well. And he was in that crucial time visiting all these indigenous people like the Polynesians. He went to the Amazon, to the Aborigines in Australia, and he went to the remote valleys of Switzerland, where they were just at this crucial time where one part of the family, brothers, went to the city nearby and had jobs over there, while the other brother was maybe still working in the farm and being eating the good old traditional food. And he observed that even within a family, but especially within one generation, their dental health deteriorated dramatically, just in a short amount of time. And that was not just the teeth, but what also happened is that because of the lack of good nutrition and the lack, see, suddenly good nutrition, chewing bones and good meat with good vitamin D's, fat soluble vitamins like vitamin D and K2 were replaced with white bread and marmalade. Yeah, just to make it very extreme. But suddenly, and all the building blocks were missing to build beautiful faces, wide faces where the cheekbones were wide and prominent, and the palates, like the roof of the mouth, was getting the right nutrition also to form properly, and the faces turned suddenly narrow and long instead of wide and bright, and that made a huge difference. And just bridging also to the breathing issue, because it's not just about the teeth that turned suddenly crooked, but also because, see, above the palate are sitting the sinuses, yeah, and the sinuses. There's the maxillary sinus that's above the roots of the back molars, and then you've got the ethmoid sinus and the frontal sinus. They are air-filled cavities, and if you have suddenly, if your craniofacial structures don't grow properly, then those airways, the volume is also smaller, and you don't get these nice open airways anymore that they had in the past. And this is what Weston Price observed. And that goes hand in hand with the width of the palate and the distance that you mentioned between the back molars. The wider they are apart from each other, the wider your nasal cavities are, and the better your nasal passages are. And this is also what you refer to with the women that are struggling these days. Because the problem is that if your facial structures, if they don't grow properly, then there are several problems that go hand in hand. And what the dentist sees and what I saw in my career, what I'm seeing is that the kids these days, they have crooked teeth. The reason why they have crooked teeth and also impacted wisdom teeth is because the jaws don't grow to their full potential anymore. And then there is not enough space for all the teeth to grow into. So suddenly you've got upper teeth that where you still have all the teeth, 16 teeth that are supposed to get into, but they are struggling for space, and then they go all over the show, and then you have crooked teeth. And in the lower jaw, it's the back molars, the wisdom teeth that need also space to come through to grow into the right spot, and there is lack of space, and they can't grow into the right spot anymore, and then they turn out to be impacted. So what that means is they are stuck in the bone. They cannot come out because the teeth in front are in its way. And then suddenly you've got all these wisdom teeth issues. They estimate that 70% of people have now impacted wisdom teeth. That's a new phenomenon. We didn't know that in the past. I mean, I'm talking way in the past, but it's getting more and more prevalent. Now, not every wisdom tooth has to be removed, but they can cause serious problems, these wisdom teeth. If they are impacted, they are also prone to infections, and they put the tooth next to it at risk as well. So suddenly you have a decayed. So the wisdom tooth is the very back one and the one in front. Because so you've got the wisdom tooth and the one in front, and the wisdom tooth can't come up in the proper position, and it grows into here. Yeah. So it's impacted horizontally. Yeah. So it can only grow this way. And then suddenly you get a big, big, nasty cavity in this tooth because there's a niche here that you can't clean. And suddenly you lose both teeth. And to take out a wisdom tooth is not that a bottom wisdom tooth. There are risks involved because there are nerve structures. There's a lingual nerve that goes into the tongue, and the intraalveolar nerve that goes into the teeth, the lower teeth, and comes out here. So when you get a dental injection, that's why you're all so numb here for hours on end. And they are very close. So a normal dentist who's not really qualified in taking those teeth out should stay away. You really need to a specialist not to cause any harm. So that's those wisdom teeth. And in the top jaw, the reason why they are so cramped is because now there are many things, in when our craniofacial structures, so our face and the cranium, when they develop, that can cause the problems that then later in life we end up with structures that are kind of set in concrete. In the beginning, we can do something about it, but this is a problem, and actually it starts way before birth, even before pregnancy. That we determine or can support or go the wrong way with how our faces and teeth and nasal passages grow, and it comes down to
That's a fascinating statement. That's really fascinating, Dirk. Can you elaborate a little bit more on that?
Well, yeah. So let's go through the whole development, how our faces and the nasal cavities and the nasal passages, how it all develops. And actually it starts before even pregnancy. See, we know that if we look, for example, at the Maasai warriors in Africa, what they do is, well, if a couple comes together and they plan a family, what they do in those cultures, then they are put aside and they get fed a particular diet, which is rich in milk that is grown, comes from cows with fresh grown grasses, so that they know it intuitively. They don't need our scientific research for that. They just know this sort of things. And then they get the right food. So when they fall pregnant, that the becoming mother has all the nutrients that they can pass on to their child. For example, we know now that the nasal septum, so the nasal septum separates our nasal passages here in the center. It's a cartilage, yeah? And that cartilage, there has been research done that if a pregnant woman can't provide the little ones in the womb with the right amounts of vitamin K2, then this nasal septum will calcify prematurely. So if
Oh,
that
really?
happens, yes, if that happens, what happens is that the whole growth of the middle face, it sits in the middle face, is kind of retarded. It holds it all back. So it can start there. And well, then once the baby is born, or when it has during the birthing process, for example, like when the head goes through the birth canal, there's so much pressure to the head that it gets squeezed down to fit through the birth canal, and the cranial subjects, on the top of our head, that calcifies very late. So it squeezes together. And normally the baby recovers from that quickly after birth, but some do not. And that is also a contributing factor to the facial structures and the whole craniofacial structures to be uh, not growing into their full potential,
Mm.
and then and then the baby, when the baby is born, normally, that there's the baby crawl. What it does is it comes up the belly and looks for the nipple of mom, and then it starts to suckle, and that would be a wonderful thing if that happens. And the breastfeeding, the action of breastfeeding, is this wonderful synergy of craniofacial growth, because when the baby sits on the nipple and suckles, what happens is that that the tongue pushes the nipple against the roof of the mouth, and that's what we need for proper growth. If that doesn't happen, if breastfeeding is somehow impaired because maybe the baby has a blocked nose or anything like that, then the baby will not be able to breastfeed properly. Or there are other issues like a tongue tie. Tongue tie means that, there's this little piece of flap under the tongue that
Mhm.
during pregnancy and development, that should retract, but sometimes there's a flap remaining, and that holds back the tongue, and the movement of the tongue is not as good as it should be, and then maybe the baby can't push the nipple against the roof of the mouth. So if all of these things happen, if breastfeeding is not happening properly, then there's a problem, because the baby will miss out on the proper trigger for the craniofacial growth that it has when the nipple is pushed against the roof of the mouth. So there are a
Wow.
lot of problems if that doesn't happen properly in those beginning stages of our life already.
Do you suspect that yourself or somebody you know has been affected by mold and mycotoxins? Well, if so, Microbalance Health Products is an incredible resource that you might want to familiarize yourself with. With so many natural non-toxic products to address mold and mycotoxins, they are an amazing company. We've used several of their products ourselves in the past, and we've referred them to lots of people over the years as well. We love this company. We know you will too. Click the affiliate link in the description below and support your own health and home while also supporting this channel. Thanks so much. Let's get back to this episode. Yeah, that's amazing. So let's go back to, going through the birth canal, for instance, and the way that that can alter the shape of the head. You mentioned that some kids, they can recover from that. The head can spread back out, do all of the things that it needs to do. Some kids can't. Is that because the birth canal was too narrow? Is there anything that can be done after birth to help? Because I know that an infant skull and even a toddler's skull is really quite plastic. It can be molded relatively
Yes.
easily. So if you catch this early enough, are those things that you can address with kids?
Well, I think, a baby should have an evaluation straight from the get-go, uh, and also an osteopath. Craniosacral therapy is very, very helpful in those early stages. But see, most people are not really aware that there might be even a problem. The child is born, and if you're not educated, if you're not skilled to look at these things, then how would you know, you know? And if you so many kids also have these tongue ties, and suddenly, you know, the young parents, they see maybe there's a problems and they are struggling, but an evaluation of a very skilled health professional should be done in those stages, especially if parents feel that something might not go the right way with the breastfeeding and things like that.
Mm. That's really quite fascinating. Do you see like baby patients and
No,
give these types of evaluations?
no, I'm not practicing at the moment. And see, this whole subject, Phoenix, is relatively new to me. Yeah. So in my career, I got more and more, my eyes opened more and more to all the complexities in dentistry, and how it's not just about teeth and gum disease and stuff like that. And this is a
Yeah.
fascinating subject that I'm slowly getting into. And as fascinating as it is, I'm looking more and more into. But it's not something that in my career over the last 30 years that I have approached too much. I was more an adult kind of dentist for adults,
Sure.
because also orthodontics and stuff like that, that was never my field of interest too much. I'm slowly getting into it, and I see uh, that there's, and this is, I'm not a single case there. This is relatively new knowledge,
It's
what
true.
I'm
Yeah.
just presenting to you. Uh, as I said, in my education, or even 20 years ago, that nobody really knew about it, or there were some people, but they were on the fringe and they were starting to get attention. But mainstream dentistry didn't have a clue about all these things, and they still don't. Most of the dentists,
Well,
you know.
and what's true, you know, like we have Dr. Judson Wall, who has trained a lot of biologic dentists all around the world, just 20 minutes south of me. I've been to his office and got some work done with them. Absolutely fantastic. But he was saying the exact same thing was, you know, 20 years ago when he started looking into this and opening up his practice, there were hardly anybody, like they thought that he was a complete kook. And even
Yeah,
still, he has a hard time getting booked at American Dental Association conferences and other things because it seems like almost from the top up, there's some or top down, there's some sort of conspiracy to not include these things inside of dentistry. It seems like there's a lot of dentists that really just don't even want to look at that or acknowledge that these types of things are important, you know, palate formation and, you know, other things.
yes, and it's, you know, like there's a fantastic orthodontist in London. His name is Mike Mew. Maybe you have heard of it. There's an
Mm.
exercise called mewing that can help people. There are certain tongue exercises that this guy and his
Oh, yeah.
father have developed, and he's quite famous. And he now has an app out, but he is struggling with the dental authorities in Britain, because his approach is completely different. He is into orthotropics. That's his expertise, and he has developed
Brilliant.
it. It's also functional orthodontics, you know, but they are, it's a bit like they are at loggerheads with the conventional orthodontists, because see, it's like this. Uh, Now that we have touched a little bit on the development of teeth and facial structures, and why we might have crooked teeth today. Now there's big business, yeah. If I mean, you see, I think in the US alone there are all, at any given time, more than 4 or 5 million people wearing braces. That's a lot of, you know.
Yeah.
And but the approach of conventional orthodontics is to, so the child has crooked teeth, they go to the dentist, straighten the teeth. So the dentist says, oh well, we just have to wait until teenage years when the growth is almost completed. And
That
then
makes
you
it
see the,
harder though.
yeah. So and then the orthodontist comes and sees the crooked teeth, and most of the time it's like, well, there's not enough space. We have to take out healthy premolars, yeah, in this area, to gain more space. So what happens is, dentist or the orthodontist pulls out beautiful healthy teeth that have functions to then move around the other teeth to make them straight. But what happens, and that's 99 or 95% of cases where this happens, is suddenly you what you're doing is you have a malfunctioning system, and you pull out teeth in a malfunctioning system and straighten teeth just to make the smile straight and beautiful. However, suddenly you have and then what happens is mostly that you pull back the front teeth. So the front teeth get straightened and pulled back a little bit. Mm-hmm. So what you're doing is you're actually narrowing the space for the tongue to sit in. But the tongue has its original size. Yeah. So it wants to sit there, and suddenly the tongue, everything is too big. And sorry, the tongue is too big, the space is too small. That's what I wanted to say. Yeah, and then this tongue falls, like falls into the floor of the mouth suddenly. And not only that, with the smaller space in the palate, you obviously again impinge on the space because of the narrow palate. So normally you should grow with a wide open palate and a U-formed shape of the teeth. Yeah, but if that doesn't happen, then the upper teeth they turn V-shaped. Yeah, everything gets narrow and pointy instead of wide and open. Coming back to Weston Price, this is what he was seeing in the old cultures, and that provides for better nasal passages. So it's all kind of connected. It's so complex, I can talk about this a little bit more in depth. Also, what happens if we have narrow nasal passages? And you mentioned the women that are mostly skinny. They are not overweight or anything like that. It's more the opposite. They are kind of skinny, but and it has been developed or seen only recently that these women are suffering. It's also mostly perimenopausal women that are mostly suffering from that. But in the past, we thought, like obstructive sleep apnea, it's for fat men with lots of fat around their neck and overweight and stuff like that. But this is a completely different issue with the women that have these upper airway resistance syndrome, because their facial structures have grown too narrow. And maybe they even have orthodontics and stuff like that that might have been contributing to. There's actually, like with these airway problems, and that can also turn into obstructive sleep apnea. The difference is when you have obstructive sleep, OSA, what that means is you have episodes, many episodes during sleeping where you're choking, so you're not breathing. So you're lacking oxygen completely. And then the oxygen level in your blood goes down, and then you gasp because it's an emergency thing that happens then. The oxygen saturation for these women or people with upper airway restrictive syndrome is not fluctuating that much, but they are often mouth breathers because their airways are constricted. This is the airways, the nasal passages, they are so tiny. So if you imagine the volume as an example, yeah, if they are tiny, then you have problems breathing. Yeah, so I've got tiny airways. I had problems like that all my life with sinuses and stuff like that. So that's why my interest is getting more and more into that subject. But if you have if you have tiny airways and the nasal passages, like there are different reasons for that. I mentioned already the sinuses, they need to be big and having good volume. But also if you have a deviated septum, for example, yeah, a deviated septum, it should be straight, but if it goes to one side, it blocks off one side, and it can block off one side quite considerably. Yeah. So, but if you imagine the airways, and then you have got nasal valves a little bit further up, they are sitting up here. So
Hmm.
First nasal septum and then the valves. And if they are really, really narrow, if you imagine a garden hose, if they are very narrow, then there's some physics coming in, how air flows through narrow spaces. And if you have let's say if you have a radius of this size and you make it half the size, then only 1/16 of the air comes through. So it's half the size,
Wow.
but only 1/16. And then the pressure, there's also pressure. If you have then pressure, then there's a lower pressure, and suddenly those valves in there, they can collapse. And this doesn't happen for people with wider airways. But if you have a narrow airways, you're struggling to get the air through. So and then maybe something comes on top of it, You you might have a little bit of a cold or whatever, and the mucus, the the lining of the mucus, there are some muscles in there that they can somehow constrict, smooth muscles that can constrict, and suddenly it gets worse and worse, and suddenly you end up breathing through your mouth. And if you mouth breathing, that's a completely different ball game, because whoever mouth breathes in a resting position breathes in probably about 3 times the amount of air than with proper nose breathing. But
Hmm.
the problem with that is if you overbreathe, which you do when you mouth breathe as at rest, so it's about 15 liters of air per minute, opposite to about 5 liters of air when you nose breathe, so 3 times
Hmm.
average. If you overbreathe, it leads to less oxygenation in the tissue, which seems to be, well, if you breathe
Hmm.
more, you should get on. And that's because what happens in the lungs is if you breathe in, then the oxygen gets into the lungs, the alveoli, and that's where the gas
Hmm.
exchange happens. So the oxygen from the air gets into the blood, and then you've got the red blood cells. So the red blood cells, they catch the oxygen, and they are a bit like a delivery trucks in the blood, the red
Totally,
blood.
yeah.
And then they carry it to wherever the oxygen is needed, so to the tissue. Yeah? And then there's a gas, then the oxygen gets used for energy or whatever. And then the red blood cells, they take the developing carbon dioxide. So oxygen gets used, turns into carbon dioxide, gets put on the truck, on the red blood cells, gets transported into the lungs and exhaled. So the problem is you can have, when you overbreathe, like through the mouth,
Hmm.
then you have lots of oxygen in your blood. Yeah. So the red blood cells, they are loaded with oxygen. However, if you overbreathe, you exhale too much CO2. So what that means is lots of oxygen, but very low carbon dioxide in your blood when you overbreathe through the mouth.
Hmm.
But what that means is the red blood cells, they hang on to the oxygen. They need higher carbon dioxide levels in the blood to release the oxygen to the tissue.
Got it.
So if you breathe too much and you exhale too much CO2, the levels drop in your blood, and the red blood cells, they hold on to the oxygen. And that's why you have less oxygenation to the tissue if you overbreathe.
Wow,
So
that's
does that
really
make sense?
fantastic.
Yeah.
Yeah,
And
it really does actually, and it ties a couple of things in for me. So, in various martial arts systems that I've worked with, one of the major components of being able to build up an electrical and a very strong electrical charge, you can even see the coronal displacement of cells under a microscope with Kirlian photography, but one of the things that we do is we deprive ourselves of oxygen in set breathing ways in order to drastically increase the carbon dioxide level. And as we do that for short periods of time, eventually all sorts of diseases and other conditions start to just kind of fall away from the body. Not that that's what we were looking to do. We were just looking to build our own power, our pengolahan. But what ends up happening is that all sorts of people with neurological conditions, all sorts of people with various endocrine related diseases, especially like diabetes and things like this, and insulin resistance, they end up seeing significant benefits. And with all of the research that I've seen on how important CO2 is to stay balanced to oxygen, that's really, really fascinating to see how all of that really ties into, you have to nose breathe. A little bit of oxygen is great in the right proportion, and how important the facial structure is. I mean, it's really amazing. And then there's also, the throat diameter too. I remember going into working with Dr. Wall, and they do all of these CT scans, a three-dimensional CT scan of the whole face, so that they can go in layer by layer by layer and take a look at what's going on. And here in the throat, I had some throat constriction, some throat narrowing, and they had a number of things. I think they suggested to me, they didn't call it this, I don't believe. I've got my folder right here. But I think it's basically the tongue out exercises, tongue up exercises, all of those. I think you called those Mew exercises earlier.
Yeah, mewing. Mike Mew is the guy. He's the orthotropics orthodontist that I referred to in London. And yeah, that many people do that. Also, I mean, it's also very fashionable these days, because it makes, like it grow the facial muscles, the masseter is improving and stuff like that. And some people do that to look better, for example. But it serves many other functional things as well, not just that.
Yeah, that's fantastic.
Yeah, and there's so much more. Like if what happens if you nose breathe compared to mouth breathing is, see, when you breathe through your nose, first of all, there's the nasal hair. Yeah, they catch all the dusty stuff that you can see floating around. And then there's, all the mucus that you have in your sinuses and in the nasal passages that is lined with, for example, with lysozyme. That's an enzyme that kills pathogens. So you have that as a line of defense as well. And then the air goes through the turbinates. There are some bony structures in there that pressurize and warm up the air, so that if you're out in the cold, you're not hit by cold air straight away. And then the air goes through the sinuses, and the sinuses, they provide lots of fluids. I think 1.5 liters fluid to moisten the air, that then is nice, warmed up, filtered and moist. It goes over the sinus, over the adenoids, and then the tonsils, which are belonging to the lymphatic system. And they are the final filter system. To get clean air into clean, warm, pressurized air into the lungs. That's what should happen. However, if you mouth breathe, it hits the cold air, filthy air hits the tonsils first, and they should be the last filter system. So we are missing this really fine-tuned filter system when we mouth breathe, And then there's the gas, I don't know, nitric oxide. Nitric oxide, this is comes in very small amounts. And it was
has to, because too much of it is a neurotoxin,
Yeah. But it's important because the nitric oxide is, it's a major component in vasodilator for the blood vessels. So if you miss out on nitric oxide, which is somehow, when you nose breathe, the nitric oxide is somehow built in the sinuses and in the oral cavity as well. The microbiome in the oral cavity is very important to produce this gas. So it mostly is produced in the mouth by the microbiome. They convert the nitrate into nitrate, which comes from green leaf vegetables. That's what you have to eat. And then they produce the nitric oxide, which you inhale as well. And it's also produced in the paranasal sinuses and in the endothelium of the blood vessels. But what it's doing is it's vasodilating. So it makes the blood vessels wider and it lowers the blood pressure. So we now know that people who are suffering from nose breathing, or who mess up their microbiome with chemical mouthwash and stuff like that, that they have less nitric oxide, and there's studies out there that we know now that they are suffering more from cardiovascular disease, heart disease, and high blood pressure, because they are lacking this nitric oxide, which was only the function of this nitric oxide. We know about that only for a short time. Only at the end of last century, they got a Nobel Prize for getting the connection done with what nitric oxide is doing. So it's a new field of expertise only. But that's how important this nasal breathing is, not just for facial growth, but even if you get older. I mean, through all of your life, it's essential for a healthy, fulfilled life to be able to breathe through the nose. And if we don't do that, and often, and it starts with the babies. I mean, if they can't breathe through the nose, then they lack the breastfeeding, and they lack the proper triggers for proper growth. They end up with crooked teeth. And that's just the beginning. Crooked teeth. It's just a warning sign for so many other things to develop. For example, ADHD, ADHD is, we know now there's a deep connection between breathing issues and ADHD, but it's overlooked. They don't look for that. ADHD, the parents go and see, and they're having problems with the child, and then they get the medication, and it's really tragic. And this, what they are having to take in those moments is so detrimental for their whole being and spiritual growth and everything. And instead of looking, well, maybe it's just a breathing issue, and if we get them to see a functional orthodontist or a myofunctional therapist, which train the muscles of the tongue, the faces, and to get things into the right direction, then these things could probably be overcome in many, many cases, just by doing the right thing and not giving the medication and looking for the cause of the problem, which is often lack of sleep in the night because of mouth. So sometimes,
I've go ahead.
So you see these little ones when they sleep with their mouth open, and it looks so cute, but it's a huge warning sign that happens, It's that it shouldn't be. Kids should not sleep with their mouth open. And if parents see that, then they should be alerted by that. That's because what happens is, if the kids sleep with an open mouth, the tongue sits on the floor of the mouth, but it should sit. The proper tongue posture is the tip of the tongue sits against the upper front teeth and covers the whole roof of the mouth, all the way back to the soft palate. And there it should sit, and then you can sit. And if that doesn't happen, you're missing out on the proper growth trigger for the whole face. Because, see, if they can't mouth breathe, then the tongue drops to the floor of the mouth, and the mouth is open. And
right.
So proper tongue, but often, sorry to interrupt again. Often, Phoenix, it's a problem of habit. So let's say a small child, maybe it grows kind of all right, and maybe it has, allergies or a cold or whatever, and it can't breathe temporarily through the nose. But maybe the airways come all right, but it has established a habit of mouth breathing already. And it's easy to keep that habit up. If it's not trained, like, hang on, now we need to breathe through the nose again, because the nose also is a trigger for proper growth, of the nasal cavities and stuff like that. And if it's not a physiological restriction, then parents should really look at it and pay attention to that the kids are coming back to nose breathing, maybe after cold or something, that this doesn't turn into a habit.
Mm-hmm. There's so much that you have said that is just, it's drawing some connections for me in a lot of different other related areas of health. Like one of the things that I see really commonly is heart disease or cardiovascular disease, especially high blood pressure in individuals who have poor oral microbiomes. We've known about that. That must have been 35 years ago that I learned about that. I was very, very young when I heard about that happening. So with that being said, the link between nose breathing, of course, and not being able to develop the proper oral microbiome actually has a huge part to, and not eating the right diet, right? You said mostly leafy greens, where we can convert the nitrates, you were saying, to nitric oxide via microbial decomposition. That is a really fascinating link. I never even thought about it like that. I always just wondered, I wonder what that direct role is. They always talk about spirochetes. Spirochetes in the oral microbiome is such a bad thing. And, the acidity of saliva and other things, which I'm sure I'm not discounting any of those things, but it's just putting something together and saying, oh yeah, nitric oxide would be a huge link there. And also the amount of oxygen just in general, the heart especially, and all of the veins can't work without the right amount of oxygen. In fact, we start getting, blood coagulation issues and red blood cell dominance over white blood cells and a number of other different types of things when there aren't proper nitric oxide levels. But then also, as you brought in, the carbon dioxide is absolutely critical there in order to have that balance. So I think that's really amazing. One of the other points that you mentioned in there was saying, yeah, okay, so let's say that you have, a restricted nasal passage, which I can't tell you how many people, since, I had a student come by, Dirk. What spawned this whole conversation, I should give her a good shout out, is a student of mine who's actually just a really good friend and a colleague, but wanted to come study Spagyria. And her name is Dr. Shannon McCarthy. And she specializes in biologic dentistry outside of Buffalo, New York. And she said, look, I'm terrible at interviews. You hear about people that have two left feet when referred to dancing. She's like, I've got two left tongues or whatever. I just get all tongue tied anytime that I'm on an interview. But she is absolutely outstanding. And she was able to look at my wife's mouth, Noriana's mouth, and say, wow, you've got UARS. And Nori said, what? How can you just deduce that by looking at it? She's like, well, this is my industry. I do it all day long. And then she goes, come here. She puts her finger inside of her mouth and says, oh yeah, your palate is definitely not developed properly and all these other things. And she says, I could tell just by how narrow all these things are. So she starts asking her, do you have this symptom, this symptom, this symptom, this symptom? And sure enough, like check, 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 check. And a lot of these things, as a healer myself, have kind of been the burr under my saddle. It's like I can take care of just about any medical condition I've ever seen. But here I am with my own wife, has a couple of these underlying things that I've been trying to approach from every different angle. I never would have thought about it. I never would have thought that it's an airway thing. Like it's such a critical piece of health that I think needs to get into the public sphere of awareness here.
Yes, it does. And it's not really, I mean, look, most dentists, they don't really know about these issues because they are still very much focused on teeth, which absolutely has its place, because teeth they need to be fixed as well. But I don't know, maybe there should be a special kind of profession that is dealing with those sorts of stuff more in a specialized way, because the dentist, the normal dentist, is fixing the teeth and the gums, and the health professional is fixing all the other things that happen in the body. But what's left out is really what's going on in the mouth and in the airways often, And then you see an ear, nose, and a throat specialist, but they have also their school medicine specialized approach to it, and they, it's very, very difficult. They, but like these airway restrictions that are more and more prevalent because often there might be orthodontics to blame for it. Because see, when I grew up in the 60s and 70s in Germany, and I went to school. I was a teenager in the early 70s. So what happened is, in my school, there was only one student that I'm aware of that had braces, these old metal ones. Yeah.
Yeah.
So it was not really a big thing in those early days, but the kind of orthodontic therapy has exploded over the last few decades. Now it's like this, that the teenager it's almost like a rite of passage. Yeah.
No, you're right. You're right. It was like that even when I was a kid. I remember going to junior high and high school, and everybody was getting braces. Everybody was getting braces.
Yeah. So what it's telling you is that this sort of treatment, braces and extraction orthodontics, what we talked about earlier on, is more prevalent. And it's now we are seeing these kids in the 70s and 80s coming up with these airway restriction syndromes, And I've heard a specialist once saying, he estimates. I heard Mike Mew talk about it, that he talked about someone saying that maybe what happens now is that 10% of the population will probably die 10 years younger because of airway problems and the associated obstructive sleep apnea and upper airways.
That's wild. That's a very statistically significant portion of the population.
What that's kind of estimated from some alternative viewpoints, because we see that more and more. And I personally see that everywhere now, people have problems breathing, And if you look around, faces, they get longer and narrow, and that means that those features, they get longer and narrow. And this is what, if you see the pictures that Weston Price took of these wide, beautiful faces, we don't see that anymore. And I don't see that as a dentist anymore. I only see crooked teeth in the younger generation and impacted wisdom teeth. And that's because of the wrong growth pattern in people.
Wow.
And it's a vicious cycle. It's a vicious cycle because, see, if a child grows up and the breathing problems start at an early age, then it leads breathing problem with the nose leads to mouth breathing. That leads to underdeveloped jaws. Underdeveloped jaws leads to more breathing problems, and it's like it goes around and around, And this cycle, if this is not broken early on in life, then you end up with adults showing up later in life with severe problems, high blood pressure and allergies and ending up with obstructive sleep apnea. And all the associated issues like dementia is related to that, Alzheimer's is related to that, cardiovascular disease, obesity. It all goes hand in hand with the breathing issues.
Wow, how insane and how intricately intertwined. Just something so simple as, our palate and our facial displacement and other things like that. Like you were saying, you take a look around at all of the different people that have this obstructed airway. You can tell oftentimes just by the shape of their, like when somebody smiles. Shannon taught me how to take a look at those things. If you can't see back here when a person is smiling, there's a very good chance that their nostrils are not actually going to be wide enough. Their nasal passages are not going to be wide enough to suck back in a whole lot of air. It's just absolutely. And then, for me as a health specialist, one of the things that I see probably in about 40 to 50, maybe a little bit more percent of my clients is that they're living in environments with mold and mycotoxins, especially aspergillus fungi. And when you do that, especially Aspergillus niger, there is a condition that is almost always telltale of you're living in a home or a space with mycotoxins, which is, fungal sinusitis, basically Aspergillus sinusitis. And so you're closing off the sinus passages, restricting them even more. At that point, a person really has no option but to breathe through their mouth in order to get any oxygen. Oh man, it's just so crazy to see how prevalent this actually might be, and how many people with certain quote unquote like mystery conditions, like I eat healthy, I exercise, I do this, I do that, how a lot of it could actually come back to orofacial, odontal, and dental wellness. It's crazy.
Yeah, yeah, very true. Now there are
So
a couple of
oh,
yeah,
go ahead.
sorry.
I was
There are
going
a
to say,
couple. Sorry, we are over the.
okay, okay, rock, paper, scissors here, huh? No, actually, just you. Go
Okay.
ahead and tell me what Okay, fine.
Okay, I
I was
start
going to
again
ask
now.
you about dental cavitations then. I was going to say, let's talk about that, because this is another stressor that is technically on the scope of dentistry that a lot of people don't really know about and haven't really dialed in. There's a lot of low-grade infections that can happen that can affect neurology. It can affect the immune system, create even autoimmune conditions. I just had mine checked because I had wisdom tooth removal surgery when I was 18, 16 to 18, somewhere in there. And I heard that there's a 99% chance that you have, if you've ever had any of your teeth removed, especially wisdom teeth, that you're going to have uh, a dental cavitation, which is essentially like a big open pocket of pus, almost cystic, that stays inside of there with bacteria and fungi and other different types of microbial pathogens that is just holding in the space because they weren't cleaning out enough of the dental tissue and injecting ozone and PRF, platelet rich fibrin into the area in order to like seal that up. And I wanted to see, do you have any knowledge about that, or any sort of experience about dental cavitations and how they affect health?
Okay, now you're touching on a subject that is also, on one hand, controversial in mainstream dentistry, and on the other hand, it's very new, and it's very difficult to diagnose it. And there's a lot of misinformation out there. So cavitations, what it means is necrotic tissue within your bone. And how you explained it is that it mostly happens with wisdom teeth removal, but also with infected root canals, or after extractions, after normal extractions. See, a tooth gets mostly extracted because there's some sort of infection in the tooth. And with wisdom teeth, it's the same. So the dentist takes out the tooth, and then so dentist takes out the tooth, and then you've got the socket here. Yeah, and the socket
Right.
fills up with blood, and then it heals over. But if this socket is not cleaned out properly, or there are healing problems in that socket, then healing problems means you can have the blood clot doesn't form properly, you get what's called a dry socket, but that's infected already, and that only closes, it's very painful, and it closes over, it takes a long time to heal. But mostly you enclose in this healing process bacteria and pathogens. And they sit then in the bone. So the bone heals over, but there is and these pathogens, they cause the cavitations. Not to be, that we have dental cavities, it's almost a similar word, but this is
Right. Yeah, yeah.
cavitations.
Totally different though. This is
Yeah,
totally different.
totally different things, and it gets confused a bit. There's actually the research there was, there's a German doctor, Dr. Lechner is his name, and he has researched this subject all his life, the cavitations, and he has given it also a different name, which is called neuralgia-inducing cavitational osteonecrosis, NICOs they are
Mhm.
called. And they sit in the bone, and they are not diagnosed easily. It's very difficult to diagnose them. You need special equipment for that. Normal X-rays will not pick up those cavitations. So as a
Correct.
dentist, you look at X-rays, you can pick up, all sorts of things that are going wrong with teeth. But with your normal 2D, two-dimensional X-rays, you're not able to pick up cavitations, or NICOs, what they're called. So you need 3D cone beams, but you also need something which is called a cavitao. This is a special, works on the basis of ultrasonic radiation, yes, like ultrasonic, that picks up somehow deficiency in the depth of the bone. It's not, this is a device that is relatively new and very costly, and hardly anyone has it. You really need to be specialized. I am not, but I know I've heard a lot of things about it. I've seen it in action. There's only one UK dentist who's using that in the UK, for example. In Germany, it's more common. But yeah, this is how rare it is. And you really need to know your stuff if you're using that machine. And that machine, in combination with 3D X-rays, cone beam, CT scans, can pick up those cavitations. There are other things like electroacupuncture that might be able to pick it up, but that, it always puts a practitioner in between the diagnosis and
Totally, yeah.
yeah. So what I'm trying to point out, it's difficult to diagnose. But if you have cavitations, and as you mentioned, mostly they come from the lower wisdom teeth, but they can come from all sorts of places. As I said, from root canals that look good in the X-ray, they can have cavitations around them. Then they are trouble, because they, for example, I mean, like, you remember the meridians that go through the whole body, go through the ear, the foot, but they also go through the whole dentition. And every tooth is related to particular organs. And if you have cavitations that somehow are related to particular organs, then you might have a problem with the energy flow to these organs. I mean, Phoenix, I'm talking about your expertise, not about mine. But this is, if you have energy blockages because of cavitations, then there might be struggle with your health. Also, these cavitations, the bacteria, they can spread, because if they get access to the blood vessels, they can spread all over the show into your bloodstream, and they can settle maybe on your heart or whatever. And they produce endotoxins, which are often way more detrimental to your health than just the bacteria alone, these endotoxins. So yes, they are cavitations. It's a completely new field, and it needs to be investigated more.
That's cool. Hearing about this from you makes me feel really quite privileged to be so close to Judson Wall, who is kind of, as I understand it, he's kind of the teacher of all of the biologic dentists, at least here in the United States, that have learned how to perform this cavitation work. And I've had those 3D CT scans, and I mean, just the preliminary appointment before you even see the dentist to interpret your results, it is $750 and a 3.5 hour investigation. I mean, they check everything. They take pictures of you from every different angle. They look at your jaw. They measure everything. I mean, 3.5 hours of like all of this insane stuff. And then it's about an 1.5 hour appointment as the follow-up appointment, which is about $350 to take a look at all of that and tell you what you need. They were able to show me with those scans how in my top wisdom teeth, where they were removed, how I do have these two holes. The one on my right side is a little bit larger, and it's basically just where tissue should be. There's these blank spots that kind of show up, the darker spots on the way that it shows up on the CT scan. Really, really quite fascinating. And in order to take care of it, it doesn't seem like sometimes, depending on the depth of them, the size, there's a relatively non-invasive thing that they can do of just injecting O3 as well as PRF, platelet-rich fibrin, into the area. And there's not really a whole lot of drainage. Mine, unfortunately, was big enough that they suggested that we actually slice those open and drain them out. And I've got to see a surgery of this actually being done. And I was just amazed at the types of fluid that was coming out for the first little while. You know, it's a very grotesque process. If you're easily squeamish, I wouldn't suggest looking for this online, but goodness gracious, it was really, really amazing to see, you know, essentially all this pus is what it looks like, this yellow, you know, cream yellow colored fluid coming out. And then eventually you'll get some blood and some white blood cells once all of that fluid is gone. But holy moly. Now, you know, like you were talking about with the meridians, this is kind of a field of specialty for me. This sits right over heart meridian, these wisdom teeth up here.
Yeah.
And so, you know, we're constantly taking a look at, you know, heart disease, especially in the United States. One of the major, if not the biggest cause of death is heart disease in the United States. We have so many different contributing factors. First of all, you know, let's just talk about the dental ones here, where we're talking about, you know, poor diet and nutrition, poor, you know, lack of omega-3s, 6s, 9s, the right balance, and all of these other things. Then we also have the intensity of facial structure and or, you know, overweight, sleep apnea, but breathing obstructions of some sort. Then we also have you know, the oral microbiome not producing enough nitric oxide in certain cases. Then we have, you know, it's like, it's just this. And then we have, you know, things like this, cavitations that might, especially for people who have, you know, received a wisdom tooth extraction, especially on the top, because that's where a heart meridian would be. So all of these things are just within the dental realm alone. We're looking at 4 or 5 major contributing factors that can play into heart disease. And if we were to do things in a wiser way, maybe even cut down on that risk a little bit, it seems like the obvious next step to incorporate this type of work into a holistic wellness care routine, you know, and to be checked for these types of things.
Yeah, it's just amazing, and all these connections, they have been established only recently. You know, it's on so many levels, new a new ground to discover, uh, like with the facial growth and the cavitations, and how much impact it has on our overall health. This is all relatively new knowledge, you know. And you know, the younger colleagues of mine, I congratulate if they are getting stuck into that sort of stuff, because that's where the future is. You know, you need to bring together dental health and orofacial health and nasal uh, breathing issues into the bigger picture, because so much suffering and disease originates from those ailments that happen in the mouth.
That's so fascinating. So we've got about 15 minutes left. What I'd like to ask you, Dirk, is what what things do you feel like in the realm of dentistry that if all of your potential patients could just be aware of maybe one really big thing or a couple of really big things that would change their perspective of health? What do you think that those might be?
Well, I more and more come to the conclusion that they need to somehow prevent dental disease and the breathing issue. What we were talking today about, Phoenix, is, in my opinion, the most important things, not just for dental health, but for overall health as well. And if we could somehow educate people in that sort of direction, you know, like you need to look after your food, you need to you need to look what your offspring is doing straight from the get-go. You need to be aware of what to look for in your children, so that they don't go down the the, the disease path that most of us in the Western world are just blindly following because we don't know any better. I mean, and look for the right nutrition. Get yourself informed about what's the right things to eat, and make sure that you breathe properly. I mean, that if we could cover those things, then we could probably avoid so many issues developing through childhood, because the earlier we get in, the more we can fix. But if we wait too long, that's the approach, for example, of orthodontics. Wait until the growth has completed, and then we just deal with the symptoms and muck around a little bit here and there. But we are not addressing the core issue. And if we can, if we are able to address the core issue from the get-go, from birth, even in pregnancy, then we can get somehow people on the right track with their health from the get-go and avoid all these bad things to happen. That would be my approach. But
Yeah, exactly.
sounds,
Well, I think
sounds,
prevention,
sounds easy, doesn't it? Yeah.
well, it kind of is, like they say, an ounce of prevention is worth a pound of cure. And I think
Yeah.
that once we become aware of these things, knowing that it's not necessarily too late for us if we find the right biologic dentist who, and also orthodontist. I remember Dr. Montez, who works at Dr. Wall's office at Dental Solutions. He actually has braces on. And I asked him, I said, why do you have braces? That seems like such a weird thing. And he's like, well, it's not because my teeth weren't straight. He's actually doing it based on an airway thing in order to change the size of the way that his bottom jaw is like tucked in. I think what's happening is that they're pulling out the bottom jaw so that as that jaw comes out, it opens up the airway a little bit more, because he was always a chronic snorer. And
Yeah.
so,
So
yeah, it's just amazing that there's so many technologies out there that they're not cheap. They're not cheap,
no,
but they
that's the
are
problem.
effective.
But coming back to the, even if adults, when all the facial structure are set in concrete and there's no growth anymore, you can do something. For example, you can still have a palatal roof of the mouth expander that pulls, like you said, Western
Yeah.
price, the molars, and you can pull them out. And what you're doing is, that we've got the midline suture in the palate, the
Hmm.
bony suture in the midline, and that contains stem cells. And if you get these stem cells, if you get them the right trigger, like pulling them apart very slowly, then they form new bone in the center. Even with adults, even with 60, 70-year-olds, you can do that. It just takes longer as with the kids, but it's possible. And by widening, because of the stem cells producing more bone in the midline, so they add more bone and everything gets wider. The nasal cavities, the sinuses open up, and you assist the breathing by just doing that. But as you mentioned, and that's, I mean, this is probably the biggest problem, especially, dentistry and everything related to dentistry, and the therapies that might get you on the right track with breathing, all of that with teeth related, growth related, is so expensive, and not
Hmm.
everybody can afford these things. And that's a little bit the predicament, the dental predicament that we live in. Like, let's say most people in their 40s and their 50s, things are established. They have fillings, crowns, maybe root canals, and they have narrow nasal passages. So what can you do? And if you're not a millionaire or whatever, or you don't want to
Yeah.
sell your house to get a mortgage to pay for your health, and this is a big dilemma. I mean, they have funneled us into, I mean, can have a conspiratorial view on that. If humanity is funneled into more and more disease, and then only a few can afford and have the luxury
Right.
to somehow rectify all the damage that is done, and the rest just has to live with it. That this is a really big problem.
It is a big problem. I mean, I was quoted something for, so, in order to open up my airway, they suggested first go ahead and do all of these exercises. And there's these little airflow clips that you can place in the
Yeah.
nose. They're made in Switzerland. I actually love those. Those are excellent. I use them when I train martial arts too. Um, but yeah, you know, things like that are good for some of the folks. Other folks, they might need as something else. So they quoted me for this therapy called night laze, which is just a 3-time laser procedure that basically just astringes and tightens up all of that tissue in the larynx and pharynx, and helps to open up the airway, help to dilate the trachea a little bit. So there is that, but that was something like $5,000 to $6,000 for a 3-time treatment, you know. And
Yeah.
then in order to do the, here I've actually got the quote right here, in order to do the bone cleanup for just these top two um, wisdom teeth cavitations, $10,100. You know,
Wow.
so it's extremely expensive to be able to engage. And like I said, just the first 2 appointments to even do the analysis and find out what all could be going on was like $1,100 too. And these companies do not accept insurance, because insurance won't cover these things. Insurance would rather pay for your medication once you develop heart disease than to try and take care of the oral procedure that can handle all of the other things, knowing that based on life
Yeah.
expectancy, it's just a numbers game for the insurance companies. So it is such a difficult quandary that we find ourselves in if we wanted to. And same thing too with I think to take out, it's like almost $10,000 per tooth to do the safe mercury removal through this office, um, which is definitely something that I don't suggest to everybody based on our last conversation. The last podcast episode we did, we talked about this mercury removal. Great thing to get the mercury out, but unless you have the right technology to be able to do it to minimize all of the risk, it actually puts the person, the dentist, and the entire environment of the dentist's office more at risk. So just getting it done by any Tom, Dick, and Harry who says I can remove these mercury fillings, not a smart idea.
No, they can remove it easily, but there are consequences, you know. It's not difficult to drill them out, but if you don't take the precautions, then you put not just the patient at risk, but also the staff and yourself as well, and the environment. Yeah, and we discussed that.
Yeah.
Yeah, so it has to be done, and it's uh, every case needs to be evaluated on a on an individual case. See, I recently had a consultation. Where I do these online consultations for people who seek second opinions. And I had this
Hmm.
elderly lady who was in their 80s, and she had amalgam fillings, you know, and she asked me what to do about it. And I said, how is it with your health? And she didn't have much health problems at all. But she got quoted, I don't know, $20,000, $30,000 just to remove a few amalgam fillings. And she felt like the teeth were all right. She doesn't have any problems. There was no infection. And I said, well, then it really depends on what you expect. Are you willing to pay that money? Are you willing to, you know, like you are in your 80s and you want these things to be removed, but uh, these things have to be weighed up, because there are also risks in removing not just the health risk in regards to the mercury. There's also the risk that you do damage to a tooth. Most amalgam fillings that are old, that are very deep, close to the nerve. So suddenly you remove an amalgam filling. Every dentist does everything to the best of his knowledge, but you end up with a deep filling with a nerve exposure, because in the center of every tooth is the nerve. And if the nerve is just sitting half a millimeter away
Oh, yeah.
under the filling, then you might breach the nerve. And then suddenly you end up with a root canal instead, you know? And these things happen. It's not just, oh, yeah, that happens every now and then. No, many amalgam fillings that are removed, we need to check on the x-ray how deep and how close they are to the nerve, for example. And if you breach the nerve, then you created more problems than you're trying to solve, you know. And this, yeah, and just the gung-ho, every amalgam filling needs to be removed, I'm very critical about that approach.
Yeah, yeah, exactly. It
Although,
sounds like it ideal, but the technicality of it brings in a lot more to question. It's like you said, if a person really doesn't have much, if any, real medical issues, then maybe it's not that big of a deal. However, maybe if they're suffering with, you know, tinnitus and, you know, Alzheimer's, brain fog, neurological conditions,
Different
you
story.
know,
Different
that
story, of course. If there are health issues and the likelihood that it might be related to mercury intoxication coming from the amalgam fillings, absolutely, I agree 100%. That was my bread and butter when I was working in Australia. My clinic was specialized in amalgam removal, and we did it in a particular way. And we worked together with a holistic clinic. They did the detoxing. They sent me patients over who were really struggling with their health because of the mercury. And of course, it's a no-brainer. You have to get rid of that. But
yeah.
not every case is like that. And we were talking about costs as well. So yeah, I think people, it's not a clear-cut decision all of the time. You need to evaluate things on an individual basis. That's just my approach.
Words of wisdom, in my opinion. Words of wisdom. That's why we love having you on the show, Dirk.
Thank you.
So,
Thank you, Fino. Thank you for having me.
yeah, my absolute pleasure. So, any other final thoughts that you might have before we start to wrap up?
Well, maybe one thing, if people are struggling with breathing, yeah, and you mentioned already these little things that dilator that go into your nose.
Hmm.
I personally use the nasal strips. I don't know if you're aware of these. In the
I've seen
90s,
those.
you saw athletes running around, football players and whatever, they had these nasal strips. So what they are doing is, because very often the problem is the nasal passages due to a deviated septum, or the nasal passages up here very, very tight. So what these things do, and there's an easy test that you can do, is you can just lift here under the eye and pull to the side. And if suddenly you can breathe better because of that. So most
Yeah.
let's just do this exercise together, Phoenix. So just block one nose, yeah.
Okay.
If you and breathe through the other one, and then do the other way around. Most people have one better nostril than the other. Did you find a
Yeah.
difference? Okay,
Yeah.
now,
I can breathe in better through my left, for instance.
okay, then close the left one.
Okay.
Now, close the left one and pull to the side, the worst one, and try
Yeah.
and see the difference if you pull to the side.
Significant. It's a pretty significant
Yeah.
difference.
So what you're doing is you're opening up the nasal passages up here, and that's where most of the constrictions lie. So these nasal strips, what they are doing is they have a little bit of a spring here in the center, and they pull it to the side, and they have a tremendous effect if you want to overcome a little bit of resistance. And you don't have to pay for surgery. You can just buy these. They might be 10 cents per piece, and they make a huge difference. So just as a last hint and something
Brilliant.
to
Brilliant. And yeah, that's an inexpensive hack. I know
yeah,
the little, inserts that I put in, those are inexpensive. I think I pay $7 or something, $7 plus shipping for one of those, and they last for 3 months.
yeah,
Supposed to change them out about every 3 months. So yeah,
yeah,
it's fantastic that there are at least a few things that we can do, even if we can't fix the root cause of the problem due to cost prohibition. What we can do is do little things and hacks that can help the conditions
exactly.
that we might have. So, great way of ending the episode, Dirk. Great way. Thank you. All right. Well, I
Okay,
want to thank you for
excellent.
being on the show. Thank you so much for showing up and talking about these topics. I think that they're very important, and we're starting to get the word out about this stuff. So hopefully in 10 years, 15 years from now, we can see that
Yes.
there's better health.
Okay, excellent. And I would be glad to contribute a little bit with these talks.
Absolutely. We're always happy to have you contribute. So, and thank you to all of you listeners out there too, who have stuck with us through this episode. Hopefully you learned a bunch of new things. I guarantee that every one of us probably knows people inside of our family let alone our neighbors and friends who are dealing with respiratory conditions or other dental conditions that might have more widespread ramifications on their health. And so, if you liked this episode and you think you know a couple of folks who might be interested, please share this with them and give them the task of sharing it with a few other folks so that we can get this information out there. The more demand there is, the more obviously there's going to be people who meet that demand, who go to school to study and specialize in biologic dentistry and in upper airway resistance problems and, craniofacial types of manipulations and so many other different types of therapies and medicinal arts that are going to help to make these much easier and more easily accessible and much easier for us to afford in the long run. The more competition there is, obviously, the better prices end up getting over time. And so I think it's an important thing for us to be able to be aware of and to spread the awareness of, so that down the road, our kids can have a much better and brighter future and have a better chance at staying healthy than we do today. So if you're watching through YouTube, be sure to like, subscribe, hit the notification icon, and let's see, if you have any comments, be sure to put those down below, and we'll check those as often as we possibly can, respond to you. And until next time, guys, have a great one. And again, Dr. Dirk, thank you so much. We'll have all of your links to Dental Decoded and everything else down in the bio down below. So thank you.
Thank you. Okay.